Welcome to Practicing Failure, where we learn about mental health, celebrate mistakes, and explore how failure helps us grow. I'm your host, Dr. Amanda Castle, and I'm excited to introduce my guest today, Dr. Erika Knuth. Dr. Knuth is a clinical psychologist specializing in maternal mental health. She works with individuals navigating the emotional complexities of fertility challenges, pregnancy, miscarriage, stillbirth, infant loss, traumatic birth, and postpartum mood and anxiety disorders. After completing her PhD, Dr. Knuth spent 2 years receiving advanced training from Boston University's Danielsen Institute on integrating spiritual and existential concerns into psychotherapy. In 2018, she became one of the first therapists worldwide to receive Postpartum Support International's advanced certification in perinatal mental health. A practical optimist, she finds joy in unexpected places and feels most alive in nature or with loved ones. Welcome to the podcast, Dr. Knuth.
Thank you, Dr. Castle. It's wonderful to be here with you.
I'm excited to talk about this. I don't work specifically with maternal issues, but I work with a lot of women and women-identified patients. And this is just kind of a part of the process in adulthood. And so anything from fertility through early childhood, there is so much in that journey, from hormonal changes, poor sleep that really affects us, relationship dynamics that shift. It's very rich. The work you do is very rich. And so we're not going to do full justice to the topic, but we're going to dip our toes in. And so a couple of the things that are just on my mind from my own work is how common traumatic birth experiences are, how difficult that journey is, and then how frequently and how many ways parents can feel like they're failing. And it is a lot, from like the food that they're eating, to the food that their children are eating, to how they're playing, to discipline. Everything is easy to judge. And so I'm excited to talk about that with you and see if we can get some different, more helpful frameworks. So you ready to dive in?
Oh, I'm so ready.
I'm excited. Okay. So you work with new parents transitioning from where they are now to the new stages of parenthood. And that may be first-time parents or bringing a new child into a sibling dynamic with children that are already there. And every stage of that, there are shifts for the whole family, for everyone involved in caretaking. And so I'm curious if we kind of think about this in developmental stages from fertility through early childhood. What are some of the common themes at different stages? And this is huge, so just go where it makes sense for you. But what are some of the common themes that you are navigating with parents?
Yeah, that's such a great question. So that in that journey of transitioning from who you once were to who you're becoming or who you're going to be as a parent, there can be this myriad of questions around what parts of my old identity carry over, what needs to go, what needs to sort of be lockboxed or put away for a time. And in that, I think a lot of these questions of failure that your podcast addresses really come up. So things like, okay, well, first of all, there are a million questions, assuming that you've sort of had the traditional route of had a baby and then that, that yielded a living baby in your arms. We're going to start there because that is, statistically not always the route. 1 in 4 pregnancies ends in miscarriage. And then on top of that, there are numerous complications, fertility, struggles, later pregnancy loss. So a stillbirth. But we're going to start with everything.
Just the simplest
path.
Okay.
Everything starts out great. Well, okay. Culture has a lot of ideas, our society does, around how are you going to feed that baby? What are you going to do around sleep? Is that baby going to have a schedule? What parents are going to work? If both parents are available in the home and are going to work, who's going to take care of that baby? And, what is the correct path? And sort of this, in social psychology, we have this concept of cognitive dissonance and cognitive dissonance reduction. And so what happens is we get really locked into an idea of what we've done. It has to be the correct path. And so we need to make it okay, even if it doesn't always feel okay. We need to and so that makes those mommy wars kind of come out stronger.
Because it's not just what's okay with me, it's then I have to justify it to everybody else who had a different path.
That's right. So I think a lot of those can be really activating, and they don't always go to plan, right? You might have planned to have a particular type of birth, and it might have gone sideways. You might have planned to have a particular type of feeding experience, and it might not have worked out that way. You might have planned to have a angelic, perfect little baby, and in fact, you got a baby who's very sensitive and has higher needs and might have some digestive issues, and that yields...
That's harder,
and it makes the parent feel like they just are constantly failing. And then there are the questions around going back to work or staying home, and it's kind of like you're damned if you do and you're damned if you don't, because either path is very painful, very challenging. So those are some of the early struggles that I see come into my practice.
One of the things that comes to mind as you describe that is, especially like the identity piece, is no matter what the transition or how you navigate it, there is grief involved.
Absolutely.
Because even if everything goes perfectly and it's everything that you wanted it to be, there's still a leaving behind of parts of you or of a season of life. And that's painful.
Yeah. Am I still that person? Are we the couple we used to be? Who are we now? There's a third person in the relationship. And how do we dance that dance when we are, in an ideal world, more in love with this child than we thought possible, than we ever dreamed imaginable? But we thought we were more in love with our partner than we ever thought we'd ever be with anyone else. And now there's a new person who's demanding all of the attention in the room.
Which can also at times lead to jealousy of like, why is all of your attention going here?
Yeah. So
which is heartbreaking.
It is. And that's so a topic we're maybe not going to touch too much on is on partner mental health. Maybe we'll touch on it. I mean, I guess I'm touching on it now. But so we know a lot about struggles in the birthing parent, but there is really extensive research at this point on partner mental health challenges and the ways in which we see postpartum depression, particularly in the partner of the birthing parent. So I do this thing where I talk about how the birthing parent and the partner sort of exist. I'm not sure how to translate this into words, but they're sort of on level playing field. And then the birthing parent, we know, is going to take a hit to because of hormonal issues and all of the things we expect in the sort of the 2 weeks postpartum. And
there's a physical cascade that happens to the body.
Absolutely.
Yeah.
And during that time, we need the partner to be able to buoy the system. However, if that partner has a history of mental illness in themselves or in their family, it can have an onset during pregnancy. It can have an onset postpartum. They might not have the resilience internally if they're not undergoing treatment or care to buoy the system. And so they're bottoming out while the birthing parent is bottoming out, and there's no one left to buoy the system. And so that's kind of when things can reach a really difficult crisis moment in the family. So we definitely don't want to do that. And so I really encourage all care providers and people who have eyes on new families to look out for the birthing partners, not just the birthing parents.
I really appreciate kind of how you frame that, because it's so easy in those spaces when we have this physical cascade and when we have, I cannot overemphasize how much lack of sleep for either partner impacts physical and mental health. And so we are not our best selves when we are not fully sleeping. And so, like you said, both people take a hit in different directions. And it's easy to want to blame and to say, like, I need more attention. And there is some truth to that, but there is also just this practical limitation of we can only give what we have to give.
Yeah, absolutely. You know, I will sort of jokingly say, but with no, it's not actually a joke. It's very serious. I will say, there's a reason that sleep deprivation is a form of torture. It's very
100%.
effective and very awful. And so I think that every stage of parenting provides different challenges, but that newborn phase to me is the most challenging because you are not able to get reliable sleep unless you're able to get someone on board or have a miracle baby who provides you that sleep. But most of the time parents are struggling with like compound sleep deprivation. And I remember thinking, I went to grad school. I never slept. I'm so good at all-nighters. Like, this is ace in the hole. But it's such a different thing when it's day after day after week after week. And you just never know. It's so elusive. You never know, when is that baby going to wake up? And when the baby wakes up, your life is just, kind of on hold, and you're beholden to this little sweet screaming child.
Who's completely helpless.
Who's communicating their deep needs to you in a way that feels very activating to your nervous system, as it should.
Yes. And the research on nervous systems in early childhood and how we sort of map our nervous systems from our primary caretakers is quite fascinating. But it also helps explain why like a baby crying is so activating. It's like, because your nervous systems are so in sync, you feel what the child is crying out for, and it is quite distressing.
Yep. There, it's just wild. You know, if you hear a newborn's crying, the word I was going to say was screaming, and that's a Freudian slip that almost happened. But if you hear a newborn crying, it is just the sweetest little coo you've ever heard, unless you are that newborn's parent. And to the parent of the newborn, it is the loudest sound in the room. It is often very...
It's the only thing you can hear.
It's blood curdling. It's deafening. It raises goosebumps. It's you just need it to stop because it's painful. Right in that nervous system activation way. You need to calm their nervous system. And you know that. You feel that. And exactly what you're saying. But but I don't think parents are well prepared for that.
At all. And I think even that process, because they start as a literal part of the birthing parent's body.
Right.
And so this is a pulling apart of your nervous system. And the whole process of watching your child grow up is those nervous systems separating, but still being connected. And it's a physically, like, it is more than just a mental attachment. Like, our attachment patterns happen at the neurological level. The research is fascinating. Yeah.
And so beautiful, right? This is where the practical optimist steps in and says, and so beautiful and so hopeful, and such an exciting time, because even if you had an experience in early childhood where your nervous system maybe was not adequately developed by your caretakers, you have the opportunity when you bring home a baby to sort of reset your nervous system, to sort of have an opportunity to rewrite it. You can do it differently for yourself and for your child. And so getting that proper care, getting somebody to lock in with you, work on attachment, attunement, dig into those deep corners, figure out why this stuff is happening, is truly invaluable.
It's so empowering for new parents to be more informed as they go into it. It doesn't mean it's going to be perfect.
Yeah, that's right.
That's the hard part.
Yeah. I was just having a conversation today with a parent of teenagers who said there's this belief in society that, quote, we're not good parents if we don't keep them safe. And that is the primary goal. But that wouldn't be a concern for our grandparents or, their parents before them. They would just be concerned about having them work in the fields or, do those other things. We have these new expectations on us as parents that we've never had before. And
the expectations shift every generation.
Yeah. And they've just really heaped on to parents of this generation around what we're expected to do and how we're expected to care for these kids. But I think, as you identified, this can be a really hopeful moment. This can be a moment that's empowering where we say, okay, we can do things differently. We don't have to follow these scripts, and we don't have to follow the scripts of our families of origin.
What comes to mind when you say that is this desire to make things easier for the next generation, which can easily turn into, I don't want my child to ever be uncomfortable.
Right.
And sort of psychological safety is different than avoiding discomfort.
Mm-hmm.
But there is a distress of if my child is in distress or uncomfortable or having a hard time, I'm doing it wrong. And that is, that mentality sets us up for failure.
Yeah. Right. Yeah.
Yeah.
This idea that there is a right way and that somebody has unlocked the code to the correct way and you just have to find it.
Or pay for it because somebody figured it out, but it's $3.99 to access that program.
Right. Actually, I think that failure is the way to find it. I think that's your inroad, is that you make 1,000 mistakes and that's how you find how to do it your way, your correct way. Not the correct way, but your correct way.
And I think that's where kind of, from an evolutionary standpoint, we learn from each generation, this did or didn't work well for us. And then we kind of have our own version of it. Because cultural context, we can never have the same experience as the generation before us. That's not possible.
Right.
But what lessons can we learn and shape what we try next?
Yeah.
And then those kids are going to have the same dilemma when they get older.
Mm-hmm. And the challenges do change, right? The questions around technology and smartphones that parents of this generation are dealing with were not questions that parents 40 years ago had to deal with, and they are not the questions that parents 40 years from now will be dealing with.
Mm-hmm. It's complicated. And I don't know, I just have so much compassion for parents navigating that impossibility. Because we want so badly to kind of say, give me the checklist so I do it right.
Yeah.
And there's some, you got to feed them. You got to help them figure out how to sleep and take care of themselves. There's certain things to check off. But every kid is going to need something different to learn how to do that. Yeah. It's such a big feat that no one can do that well or perfectly.
Yeah, right. We all can do it well. We, sort of that Winnicott good enough mother concept.
I love the good enough mother.
The good enough mother, Donald Winnicott.
Can you describe the good enough mother? What is that concept?
Right. So this idea that in order to show up for our kids in a way that provides what they need, we have to show up in ways that are so much less than the expectations we have heaped upon ourselves. So that idea of showing up to meet their basic emotional needs, to meet their needs of clothing and shelter and safety and security. But really, we know from research, 30% of the time, if you show up 30% of the time, your child's going to develop a relatively secure attachment. That is such a low bar
So 30% of the time. That's nothing.
That's nothing. 30% of the time. You have to be like a passable parent 30% of the time in order for your kid to come out okay. Wow. I mean, if we're talking about months of the year.
Yeah.
What? You have to show up 4 months of the year.
Please be more present than that for your child.
To be passable.
But
right. Please be so much more present than that.
Than 4 months. But yeah.
But right. I mean, so I find a lot of hope in that again, because I think we all, at least, you know, those of us really invested in raising our kids and wanting to have positive psychological outcomes for the next generation, people invested in that sort of tenet are very anxious about how to do it well. How are they going to not mess their children up? There's a refrain I hear so often. This is going to, you know, scar them or this or that. And it's like, well, yes, there are traumatic events, but you going to work or you going to the gym so that you can show up more fully as a parent is probably not the thing that's going to impair your child's secure attachment.
But also, even if you do show up 90% of the time perfectly, that doesn't mean your child's not going to have a hard time in life.
Right.
And part of life is just struggling and figuring out our identity and our place in the world. And some of that comes with separating from our parents and understanding where they end and we begin. And they may need therapy in the future, not because you failed as a parent, but because that's just part of the human experience.
Mm-hmm. Yeah.
And that's, I think, scary and hard to accept.
Absolutely. That idea that our children might need therapy in the future, or that they might encounter some difficulty at some point. You know, I think if we can wrap our heads around the idea that our role as adults and parents in the lives of our children, our young people, is not to protect them from any difficulty, to bubble wrap them, but actually to equip them to handle difficulties so that when they face the inevitable difficulties that life will bring, they know how to handle them. That is the goal. That's
the crux.
That feels like a much more attainable goal and actually something that is going to serve both parent and child far better.
That's a really helpful kind of redirection of that energy into something more doable.
Right.
Honestly, yeah.
Yeah.
Okay, so we've talked about the themes of grief and transition, things not going to plan, the unexpected, kind of navigating that, a level of perfectionism that comes with entering this phase of life, and then also the judgments that we're navigating, either from ourselves or from the people around us.
Yeah.
And I want to take a minute to ask you about, we're going to kind of pause the failure talk about postpartum for a second.
Sure.
Because this is, I think, generally not well understood, but a common experience to varying degrees. And as you said, both for the birthing partner and the supportive partner, it can happen in both directions. And so how do we understand what postpartum is, and in what ways is that different than depression?
Yeah, that is such a great question. So there are lots of difficulties that can present, sort of perinatal mood and anxiety disorders that can present during pregnancy and postpartum. And when we in culture sort of talk about like postpartum depression or postpartum, I think culture at large is sort of specifically thinking about a feeling of sadness in the birthing parent immediately after having a child that maybe then goes away, right? And so what it actually looks like can be very different, varied and depending on the presentation. So there are many sort of perinatal mood and anxiety disorders. So let's start with depression.
Mm-hmm.
I actually see a lot more anxiety in my practice than depression. So depression, anxiety, obsessive compulsive disorder is one that's huge, has my biggest heart because it is, in my opinion, just such a mama bear impulse. And
yeah, what comes to mind is like, that's their best effort to protect the child and keep them alive.
Absolutely. And I'd love to talk about that in just a second some more.
Yeah.
Because it is so misunderstood. And then we have more of the severe sort of, if a person has bipolar disorder, that's kind of where we can sometimes have a related psychosis. So psychosis is part of a manic episode. And then sometimes there's freestanding postpartum psychosis. But those are some of the main things we see, as well as postpartum post-traumatic stress disorder. Yeah. Subsequent to typically a traumatic birth or traumatic experience in the perinatal period. So, so kind of coming back to these original three, the depression, anxiety, OCD, you know, what's the difference between postpartum depression and run-of-the-mill depression? Well, honestly, not a lot in some ways, right? So, because if you have postpartum depression that goes untreated, it morphs into major depressive disorder that you then have with you for the remainder of your life until you seek out treatment. Same thing holds for anxiety, right? So, so in that way, I say that they're actually very related. But what's different is sort of, well, I want to pause and give a little hat tip to the baby blues, which I think maybe is what you're referring to when you say postpartum. So the baby blues is something we expect to happen in everyone. Everyone who has a baby, because of hormonal shifts that happen immediately postpartum, there is sort of this crash out of hormones, can be a little bit of a grief-stricken time, having some sadness or even tearfulness that goes above and beyond what the person is typically accustomed to is not atypical in sort of that early sort of first 2 weeks postpartum.
Well, I imagine that's just like the body kind of resetting after flooding with not only hormones, but like adrenaline and other things necessary to endure that physically taxing of an event.
Absolutely. And along with an entire human that has exited the body, the placenta has also exited stage left. And, you know, and so all of that causes a big crash out. And part of that, you know, is to initiate lactation. And so some of that, you know, it's sort of the body's way of, you know, we want the uterus to contract, because if the uterus stays the size of a bowling ball, you know, that's not very helpful. We need the uterus to contract. Where the placenta was attached to the uterus, after it leaves, there is a giant wound.
Yes.
Inside the body of the person who has just delivered the child. Open wound.
Which needs inflammation to heal, but inflammation is part of anxiety and depression and other mental health disorders.
And in fact, stands counter to breastfeeding. So when you have inflammation, there's a release of cortisol. So that then can result in an increase in pain with breastfeeding, even if it's in a different part of the body, which then, guess what? Leads to a decrease in oxytocin production. So then not because the mother and child are having a difficult feeding relationship, but simply because the woman or birthing parent has a giant gaping wound inside of the body, which has tons of inflammation, then that can yield pain while breastfeeding, which then can lead to aversion for breastfeeding and a lack of that oxytocin response, which yields all that good squishy, whooshy, lovey-dovey stuff that we want. We want both the parent and the baby to be flooded with oxytocin postpartum.
Which would counteract some of the depression and other difficult emotions.
Absolutely. Absolutely.
But if it's not flooding in, then that balance is off.
Right.
It's harder to work through.
Yep. So as CRF goes up, oxytocin goes down. And as inflammation goes up, CRF goes up. And so we have to be very mindful of the entire holistic picture of the body and what's happening, and sort of being patient when our bodies aren't responding the way we want them to.
They're healing and trying to take care of themselves.
That's right. Yeah.
And makes me think so much about how quickly we expect birthing parents to go back to work.
Mm-hmm.
And it's fairly outrageous.
Yeah.
Because that level of recovery, 2 weeks is not enough for the body to rebalance.
I mean,
to heal.
2 weeks can be a luxury for some people. We have no maternity leave in this country.
Oh, it's honestly quite shameful how we manage that.
Yes. Like parents need to be more well supported in order to be successful postpartum, in order to have successful, thriving families.
Yes.
And the sad reality is we often aren't.
Yeah. So lack of support, all of these hormonal shifts in the body that may or may not be doing the ideal pathway.
Yep.
Plus lack of sleep, which sleep is integral to our healing process in the body.
Yes.
And so that is another just complicating factor in here. So as we identify all this, like they may need extra support, I'm also mindful that time feels like a luxury in this like time warp zone of like fresh after giving birth.
Yes.
So what's a good marker or a helpful thing to keep an eye out for of like, this is when I need to reach out for some sort of professional help?
Yeah, that's such a great question. So if you're seeing symptoms persist for more than 2 weeks, that's a really good indicator.
Okay.
That you've now passed the baby blues point and you've crossed over into, postpartum depression territory.
Wonderful. And I know there's lots of tools and resources for whether that's medication or talk therapy or combination of the both or group therapy, support groups. Like there's lots of ways to access that.
Absolutely. Social support is actually a huge piece for new parents. So even if you don't feel comfortable leaving the house or going to an in-person group, one of the great things that's come out of the more digital age post-pandemic is that there are support groups available online.
Yes. And it's easier to send food to someone that you care about who just gave birth or send groceries, or if you have the ability to do that. That's a wonderful gift.
Yeah. So that was kind of the difference between, postpartum and depression, but anxiety is actually kind of what I was saying is what I see more in my practice, and people are surprised by it. And, people might find themselves, more nervous or cleaning more or worrying more. And that's, also something to keep tabs on, and there is help available. And, worries about, watching the baby sleep, that sort of thing are very common. And people think they're maybe the only ones doing it, or maybe they think it's a very normal thing. Common and healthy are not always the same. So if lots of your friends are doing it, that doesn't necessarily mean it's healthy.
Yes. And you're balancing health of the infant as well as your own health.
Yeah. Yeah. And then obsessive compulsive disorder has my heart for these perinatal mood and anxiety disorders, because people will often think that they are going psychotic. They'll have intrusive thoughts about dropping the baby, or, so they'll go down the stairs sitting down, go down on their bottoms, or, get rid of all the knives in their house because maybe they're going to accidentally cut the baby while if they're, holding a baby and chopping vegetables or something. So we got to get rid of all of the knives, that kind of thing. It's so protective. It's so loving. It comes from such a kind, caring place and is very different from how postpartum psychosis presents. And so if those are thoughts that a person is having, whether they're those thoughts or scarier thoughts, please talk to somebody about them. You don't have to go through it alone. People can often be really afraid to seek out help because they feel afraid that their baby's going to get taken away. But, if things are dire in the postpartum time, postpartum depression or bipolar disorder, things can go sideways really quickly. And that's where we do have deaths that happen that we don't want to have happen. And so please do seek those out. Again, those are, that's not related to
it's a small
OCD.
percentage.
It's tiny percentage.
Yeah. But it's terrifying if you're the one going through it.
Or the partner of the person going through it.
Yes. Because psychotic is a word that's thrown around a lot, colloquially.
Yeah.
But what is kind of psychosis? And maybe just couching it within the birthing experience.
Yeah.
How do you know when you are maybe being overly thoughtful versus an actual psychotic break?
Right. So a psychotic break in a mom or a birthing parent. So I did not see this movie, but it's my understanding that this is what is portrayed. The movie Tully with Charlize Theron. I believe they pitch it as a postpartum depression movie, but actually it's a postpartum psychosis movie, is my understanding. If you want a more nuanced, that might be a good view. But people might talk about like the other me going and doing something. The other me wants to put the baby in the oven, or the other me is going to hurt the baby. And those are sort of, there might, kind of along with the psychosis, you might see some of the manic symptoms that are part and parcel to bipolar disorder. So, racing speech or feeling like they can do anything at this grandiosity of thought, we would call it, or, the person, I want to pause for a second because that racing speech can also sometimes happen with anxiety. When we're anxious, we can feel keyed up and talk really quickly. So just because your partner or friend is talking really quickly in the postpartum period, you don't have to be fearful that
and even just like lack of sleep and then kicking into an adrenalized state.
That's right. So we don't want to
get things done.
Any of these in a out of context. So just have some nuance and sort of put many pieces together. But having somebody who's well-versed to evaluate the person is very wise, because if your partner or if you are experiencing some sort of psychosis, the onset is very fast and the resolution is very fast as well. And so that's where we see a lot of these incredibly tragic cases of infanticide, where a mother has tragically, this is usually a story of a mother has tragically murdered the infant, right? So that is I want to say almost always a case of postpartum psychosis. And as soon as they get to a place of health, they're horrified, but also in such deep grief. Because that's
not who they want to be.
Not only that's not who they want to be, that is their most beloved baby. They are more in love with that person than anyone. And not only is that person now deceased, but the person responsible is them. And so you have a lot of women who are incarcerated for infanticide.
For something they needed support for.
They needed support and help for. They needed to be identified, and they needed someone to intervene.
And I think the default place of comfort we might go is that couldn't happen to me. And I will say, going back to the lack of sleep, and the hormones, any human is vulnerable. Like, we are fairly fragile creatures to chemical changes, to hormone changes, to lack of sleep can trigger this in anybody.
Absolutely.
And so having some humility and some compassion and grace of like, this isn't something that only targets people who have X in their family history or Y in their lived experience. It's just, this is a part of being human. And things can shift suddenly, and then we have to deal with it.
Yep, for sure.
Yeah.
That said, a person is much more at risk if they have a personal or familial history of bipolar disorder. So
Yes.
if a person has a personal or family history of bipolar disorder, being so mindful and being proactive about seeking out treatment before and during pregnancy is of the utmost importance. And seeking out a provider that's specifically versed in maternal mental health, in perinatal mental health. So a psychiatrist who has done a fellowship in maternal mental health, for example. We want really skilled providers, a therapist who's done training and advanced training in perinatal mental health so that they can really support you.
And they can understand the nuances of these changes.
Absolutely.
Yeah. And even for people like myself, recognizing when we've hit the limits of our own training and when to say it's ethically responsible to pull in other providers to give this person the support that they need.
Yeah. Yep. And, you know, there's a lot of us in the perinatal world who do adjunctive care. So maybe a person had a longstanding relationship with a therapist, but suddenly they've got this onset of struggles during maybe fertility struggles, or maybe they've lost a baby, or maybe they've got postpartum depression. And so they'll come to see a specialized provider like me for that specific issue.
Yeah.
And, you know, they can continue their relationship with their therapist who supports them with the rest of their life. But we are working on this one issue, right?
Yes.
And they come in and bada bing, bada boom. And then they carry on with their former therapist.
Which, when that happens, I find it so beautiful when providers are working together to give this wraparound care and to be non-territorial, non-judgmental in the way that really serves the client the best. Yeah. So a note on postpartum trauma.
Yeah.
Because I've been thinking about this, just traumatic births, I'm realizing are much more common than I thought they were.
Yeah.
And I've noticed this pattern of traumatic births, but being taken care of in medical settings where they are so accustomed to it that they don't register it as traumatic.
Right.
And so then the patient comes out and they're like, but I feel traumatized, but all of my providers were very calm and everything felt normal.
Yeah.
And so, like, am I just making this up? And I'm curious if this is something maybe you have insight or can speak to, of how do we navigate that disconnect?
So I train doulas about 3 times a year in perinatal mental health. And one of the things we talk about is how powerful the role of a birth doula is in keeping a birth that went sideways and went differently than the parents planned from being, how important a doula is in maintaining it as being just a sideways birth and keeping it from being a traumatic birth. The differentiating piece tends to be if the person who is giving birth feels like things are happening and they are completely out of their control. And so things are happening to their body, things are happening in and around their body, and they have no control over what's happening. And so
that informs the experience.
That informs the experience. And that if there is that feeling of being out of control, it can suddenly make it feel like a traumatic birth. It makes it a traumatic birth. Whereas it could have felt like a birth that didn't go the way you wanted it to go. Even the storyline could have been the same. And so I'll talk with the doulas about, you might not be able to go in for the C-section. And so if there's a crash C-section that needs to happen, and this was a family that wanted, a med-free birth, or maybe they just really didn't want to have a C-section, you are running down the hallway next to them, and this is what you can say. You say, okay, well, it looks like there's some distress for the baby, and so the doctors are suggesting that maybe we can, a C-section is going to keep you and the baby the safest. What do you think about that? Are you okay with that? Do you consent
Giving
to
them
that?
agency still.
Does that feel like a good plan? Bottom line, it's not in their control, right?
Mm-hmm.
This is the plan of how the baby needs to exit safely. But if the birthing parent feels like they have a say in it, that says somebody consulted me and sought out my consent, it changes everything in the story, right? Because then they say, yeah, that makes sense. Of course I want the baby to be fine. Yes. Okay.
Why would I not choose the safest
I wanted,
path?
but of course we can do this. Are you going to be there with me? I'm not. They won't let me in. But, your partner is going to be able to be there, and I'm going to be there in the recovery room, or I'll be outside. Is there anything I can bring you? Or, there are conversations that you can have with that parent. That might be lofty, but that quick 3-second, hey, looks like we're going to need a crash C-section. How does that sound to you? Changes everything.
That's interesting. And as you're talking, I'm thinking through the various ways that we define trauma. Because in the medical setting, it is a very specific, rapid injury in the body. Mm-hmm. So birth in and of itself is fairly traumatic.
Yeah.
C-sections, surgery of any kind, is traumatic to the body.
Yes.
How we frame it can then inform PTSD, not PTSD. Mm-hmm. And there are sort of capital T traumas of anyone who goes through this is going to have a reaction. Mm-hmm. And then there's lowercase t traumas of our experience of this, the way the body responded was as a trauma. And now how do we integrate this and frame it and allow ourselves to move on from this? And I think your intervention that you're discussing is starting to do that work in the moment rather than months down the line.
Right. So if we think about trauma, what makes it a capital T trauma? If we go to our DSM, one of the key features is that it felt like there was a risk of death to the person or someone else. Okay. So if we're running into a crash C-section, we check, right?
Done. Yeah.
Okay. So if the birthing parent is not informed or is not consulted, suddenly their experience is, oh my God, I don't know what is happening. I think my baby's dying. It's going to die. Did my baby die? Am I dying? What's happening? Everything is terrifying, and it's cold and it's bright, and I don't know what's happening.
Oh, that sounds horrible.
Flash to that subtle shift, and now the parent is the protector. Now the birthing parent has saved their baby solely because they've been consulted, solely because they've been asked the question, are you okay with this?
They got to take an active role.
Then they say, yes, I want to save my baby's life. My baby's having trouble breathing. Something is the matter with my baby. My baby's in distress. Absolutely. Let's go into that freezing cold, very bright operating room. Cut me open, do major abdominal surgery, and get that baby out. It changes everything. The parent is the superhero, not the victim.
That is a really helpful, I think, message to physicians, nurses, doulas, anybody involved in the birthing process in the hospital. It's take that brief moment to consult. Occasionally you can't because it is that rapid and that dire. So we hold space and understanding for that. But when you can, what you just described is less than 30 seconds.
Less than 30 seconds. And I would argue it can happen in the OR. It can happen as
running down the hallway.
Running down the hallway as the person's being prepped at any point. any person, have an orderly have the conversation, have the physician have the conversation, have the birthing partner have the conversation. As long as someone gives the person who is about to be sliced open the heads up and,
like, this is necessary.
Yes. Yes. Yeah. The empowerment to say, yes, I am on board. I do want this. It changes everything.
That's so helpful. Thank you.
Of course.
Yeah.
Yeah, I'm so glad.
Okay. Pulling it back into failure.
Yes. Yes.
So we talked some about it earlier, but there's so many ways, and I think a lot about social media and the strong, because what gets clicks is strong opinions. This is the right way to do it. This is how you can shape behavior. This is how you can make sure they feel attached and loved. This is da-da-da-da-da. And if you try to stay on top of all of the literature out there, you will go mad trying to be the right kind of parent.
Yes.
So how do you see some of these failure narratives affecting parents? And then what might be a more productive narrative?
Yeah, that's so wonderful.
And some of this may be a repeat of what you said earlier, but I think is helpful for us to hear again.
Totally. No, I think it's a beautiful question. Even back to that idea of the cesarean section, for a lot of people, they've failed at birth or their body failed them. That is something I hear over and over again. And can be a very difficult narrative to shake. But actually,
and then that scar feels like a visible reminder for life of that sense of failure.
Absolutely. And that can then make sex difficult because how do you have sex when you have to reveal your scar? And then that just reminds you of the hardest time of your life. And so many people struggle with these things. And I think the shift to, when I think about a child learning, how many times do they fall before they learn to walk? How many times do they babble nonsense before they communicate in their parents' native language, right? So do we say, oh, look at that baby failing at talking?
What a dummy.
We say, what a dummy. He's a dunce. Or do we say, oh, do.
Yeah.
And we talk, oh, you like that? Oh, do you want to have this? Right? We converse with them. We make their failures, perceived failure at successful communication in the parent's native language.
We praise what works well.
We praise what works well.
Yeah.
And we forgive what didn't land, right? And so maybe we can have that same expectation for ourselves. So
I love it.
If your body didn't have a vaginal birth, okay. You know what? Some bodies don't birth vaginally. Okay.
Does that child still exist? Yeah.
Yep. And that's okay. Did you really want to breastfeed and that wasn't successful? That's really hard. That is devastating. That can feel like a failure. That can feel like you're failing your baby or your body's failing you. And yet you can still have a very bonded, intimate feeding relationship with your child, whatever that looks like.
Well, it makes me wonder if sometimes this focusing on the failure helps us avoid feeling the painfulness of the grief.
I love that. I love that.
The truth is we just don't want to sit in how sad it is.
Right. Right.
But if we can, then we can let go and kind of forgive ourselves that, like, we did our best.
Yep. Yep.
And that's all we can do.
That's all we can do. Yeah. Yeah. I mean, I think it kind of ties back to this idea of practical optimism that is just sort of so important to me. This idea of being optimistic, hoping for the best outcomes. But what are the practical steps I'm going to take to make sure that happens, right? We're going to do all we can. It's not always going to work perfectly because that's not a reasonable expectation for life, right? But we can still find success and joy in that, and we can still reach our ultimate goals.
I love it.
even if we don't meet every sub goal along the way.
I think of our like optimism or idealism as sort of the compass. Like it tells us what direction we need to be going.
Yeah. Yeah.
But then the journey along the way is going to be filled with all of these learning opportunities.
Yes.
And so we return to the ideal as like, am I headed in the right direction? But like, I'm never going to arrive at east. East is the direction I go.
Yes. Yes.
Yeah.
Yep. And so every failure is just an opportunity to calibrate our compass.
Yes. Yeah. I love that.
Yeah.
And something you were talking about just now triggered this thought too of how we respond to ourselves, which is why I encourage a lot of people when they're thinking about entering the parenthood journey, like that's a really good time to do some of your own therapy, because how we respond to ourselves internally tends to be how we end up parenting.
Ooh, yes.
And so when we are hypercritical of ourselves, but we're like, I'm not going to do that to my child. Well, when you're sleep deprived and you're stressed and there's a lot of things on your plate, that is probably how you're going to talk to them. Yeah. So as we shift those narratives into what you were saying of being more graceful, praising the things that work, highlighting the opportunities for success, if we can do that for ourselves, it really shapes the type of parents people turn into.
Yep.
Yeah.
I love that.
Yeah. Okay. We've covered a lot of ground and I've really enjoyed it. But for the sake of time, I'm going to move us to the next question.
Great. Let's do it.
So if you feel comfortable sharing, is there a type of failure that you've experienced in your own life or career? And can you tell us about how you worked through that failure and how you grew from it?
Oh, okay. That's a good one. Well, first of all, I want to say that I make 100 mistakes every day.
Amen.
Right? And I think a really important part of being human is knowing that that's going to happen, knowing that that's bound to happen. And I'm not trying to avoid that. I'm just acknowledging that when it happens, I have responsibility to take ownership of anything that like as a consequence may have hurt another person or may have left something undone. Right? So if by making a mistake, maybe I didn't communicate something clearly. And so a person thought we were meeting, actually this isn't my story. This is the story of how my grandparents met, but, they were supposed to meet at the Plaza Hotel in New York City. And at that time there were 2 Plaza Hotels in New York City. One went to one, the other went to the other. And were
that's
both
a rom-com.
Furious with each other for standing them up. How dare they?
Yeah.
But they made a mistake. And they each owned that they, went to the one that the other one wasn't at. And so they gave each other a second chance. And the rest, as they say, is history, right?
You're here.
I'm here. So if we can own when a mistake has happened and apologize for any hurt that's happened as a consequence of that, that's where I think the good stuff of life is. So gosh, a mistake or a failure that I've made, I could tell you hundreds and thousands. Okay. So I'm going to stick with a failure that's kind of on topic with this new parenthood experience. So when I had my first, I was very dedicated to the idea of breastfeeding. That was something really important in the family I grew up in and was important in the community that I was, the sort of community of parents that I was having kids into. And when I had my first, that was the plan. That's how I was leading off. And it didn't go great initially. And I just felt like a total failure because he was losing weight and I would just cry in the shower and think,
that's so scary.
I'm failing him. And it was just such a hard moment, but I ended up connecting with this incredible lactation consultant and she was just absolutely the right fit for me because her focus, so many lactation consultants out there, their focus, and actually people in the world, their focus can be on like exclusive breast milk for the first 6 months. And like, as though it is
this is a holy
gold.
grail.
This is the holy grail. And so here I am thinking, oh my gosh, I'm not making enough milk and my baby's starving to death. And I'm like, what am I going to do? I meet this woman and her primary objective is the nursing relationship, is that we have a beautiful bonded feeding relationship. And so I come in and I'm holding him and she just touches my shoulders and she's like, you relax. Because I had so much stress and tension that I was now bringing into that. And I was never going to have a successful feeding relationship if I was bringing all of that stress, as we talked about earlier, into it. And she was like this sage guide, and I saw her all the time. And she made my first year of parenthood a dream. Was it
beautiful?
Was it perfect? No. Was it exclusive? No. But it was everything I could have hoped it would be.
Did your child get nutrition?
Yes.
Was he able to grow?
Yes.
There you go.
He did a wonderful job, and we had such a beautiful bonded relationship, and still do.
I love that.
Yeah, and so I it was so transformative for me too, as a provider in the field, kind of hearing about or experiencing rather her approach of like, actually, this is just about you forming a healthy attachment with your baby. Like, I don't care how much milk you're producing. We can check and you'll have a scale and we'll do those things because your baby does need to gain weight. However, the more important thing is that you and baby have a wonderful, connected relationship. And it changed everything.
As you kind of tuned into where you were holding tension in your own body, one, I could see that feeling scary to be vulnerable and have somebody see that.
Yeah.
And so how do you take that in and say like, yeah, I do need to like physically relax?
Yeah. Yeah. I mean, I think she was just an angel.
Her delivery.
and her delivery was so maternal, actually. So I think having a person share that with you from a space of loving kindness and nurturing is everything, right? But I went from these very detailed notes of every feeding and every diaper and every input and every output and every how much did he weigh and the ounces and the this and the that, to just like, oh, we are snuggling and staring into each other's eyes and
being present.
Isn't that wonderful? Yes. Absolutely being present and not caught up in perfectionism and the distraction of getting it right.
That's such a helpful example of how fixating on the doing it right pulls us out of the experience of the relationship. Yes. And I think in parenting, but in all of our relationships, when we're so focused on checking the boxes, we lose the person in front of us. And how on a physical level, like being in that space together, being tuned in, changes the experience.
Yes, absolutely. If we can accept that we are people who make mistakes, who fail, who are going to mess up 1,000 times a day, then we can be present with the person in front of us because we know that they're going to mess up too. And so we don't expect perfection from them. And we know that they don't expect perfection from us. And we can really relax into that. And that yields a secure attachment, a relationship that has legs and carries you forward.
And can breathe and change shape as it needs to.
Absolutely.
Thank you for sharing that. That's a very powerful lived experience. Yeah. All right. Well, if people would like to know more about you, if they would like to work with you, where can they find you?
My website is magnoliawheaton.com, and that is the best place to reach me.
Wonderful. And you are based out of Illinois. Are you on PsyPact?
I am a member of PsyPact, and I'm also licensed in the state of New Mexico.
Wonderful. So if anyone's interested in working with you and they are in a PsyPact state, it's fair game.
Yep.
Wonderful.
Absolutely.
Thank you so much for venturing into this really delicate space. Parenthood is so, it changes your whole life and your whole identity, and it's very fragile and flexible and complicated. And so I'm glad people have someone like you helping them navigate it.
Thank you. I'm glad they have you as well.
Oh, thank you.
Thanks for putting this podcast in the world.
Thank you.
We need to fail up more often.
That's the goal.
Yeah.
Onward and upward.
Yes, absolutely.
Yeah. And thank you to everyone who listened today. Remember that failure is a necessary part of growth. So keep failing, keep learning, and keep growing. Special thank you to everyone who contributed to this project. Consulting producer and editor, July Diaz. Producer and graphic designer, Ben Castle. Logo art by Josie Huang. Theme music by Daniel Rogers.